Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Back pain affects 90% of Americans at some point. Neck pain affects about 10% of the population at any point in time, up to 45% each year. Back pain is the second most common reason people see a doctor, but just behind the common cold. Leading cause of disability in those under the age of 45. And it's seen in up to 40% of those who undergo back surgery. When you look at the cervical and lumbar facet joints, they're about the size of a thumbnail. They go from the neck all the way down to the sacrum. You can see there's one on the right and the left in the back. And they have cartilage, just like the hip or the knee. They are prone to arthritis. Together, cumulative, they provide an incredible range of motion for our spines. 45% of the time, they're the cause of low back pain. There really is no successful joint replacement for the facet joint yet. Making the diagnosis of facet joint arthritis and pain is very difficult. History and physical exam can be indicative. X-rays can show facet joint arthritis, but you may have terrible arthritis in the facet joint and no pain, so it's not always indicative. And a CAT scan can show you nice resolution. Here's an example of a CAT scan. On the right here you have a pristine looking facet joint on the right and the left, okay? These look great. Here you have pretty bad arthritis, kind of a rattiness, some bone spurs, the joint's kind of hard to see. This person may have no pain whatsoever, but they definitely have arthritis. So it can be a coin toss. You can have severe pain with very little arthritis or vice versa. Even the best trained spine doctors get the origin of someone's back pain wrong half the time. So when you start looking at options, diagnostic injections may include a medial branch block around the facet joint, which can numb up these medial branch nerve endings, or an injection right into the facet joint. These may work really well. They may provide pain relief weeks to months at a time, along with giving diagnostic information with saying, aha, this provided pain relief, therefore that joint is the cause of my patient's pain. Some say it's 50% pain relief, means a positive result. Some say 80%. Some insurance companies require 80% pain relief on 2 separate injections before approving a radiofrequency ablation. We'll get to the radiofrequency in a second. Medial branch block in and of itself may provide pain relief for 3 months on average. It's both diagnostic and therapeutic, as mentioned. When it wears off, it can either be repeated or you can go on and have a radiofrequency ablation. So radiofrequency ablation has a lot of names. Radiofrequency neurotomy, medial branch neurotomy, medial branch thermocoagulation, radiofrequency denervation, lesioning. Some people shorten it and just say RFA or RF procedure. They all mean the same thing. Here's 5 facts about RFA. The current used is actually the same wavelength as radio signals, but there's no FM radio involved in the procedure. It can actually be more painful afterwards for a while. Pain relief can last upwards of 18 to 24 months. You do need to have that diagnostic injection prior to getting insurance to approve it, and it truly has been a revolutionary treatment for both back and neck pain. What exactly does a radiofrequency ablation do? All right, here we're looking at nerve root coming out, okay, and we have a facet joint here. So the nerve root gives off these little nerve endings called the medial branches, and they supply sensation to up here and then the other joint down below. So what the radiofrequency ablation does is it goes into this area and it deadens these medial branches. So let's say it's this joint being treated. It would deaden this one and it would deaden this one to try and give pain relief, because these are only sensory and they are the reason this joint, when it's arthritic, can have pain. Okay, so here's the catheter coming in and you can see it deadening one of these medial branch nerve endings. So here's how the procedure works. Instead of needles being placed, it ends up being these catheters, okay? The newest radiofrequency machines allow you to do multiple levels at one time, so that's why you see 4 catheters in at the same time. Image guidance, either with fluoroscopy or ultrasound, is used to do placement, and then the pain doctor will stimulate these catheters initially to make sure that your leg doesn't jump or it's too close to an actual nerve root. And if that's the case, and none of that happens, then the procedure is actually performed. Usually it's heated up to 80 degrees Celsius for about 90 seconds. This will deaden those medial branch nerve endings. Depending on the area of the body, it may be a little bit of a different setting. It's an outpatient procedure. It takes less than an hour. You can undergo sedation, or you don't necessarily have to. The results show that over 80% of patients get pain relief for up to 2 years. It's significant and longer lasting pain relief compared to steroid injections. It gives greater range of motion. It lowers the use of analgesics, such as narcotics and other pain medications necessary. Short recovery time. Complications: a person may have increased pain for a week or so due to spasms, and this settles down. May have increased pain for months if the nerve is only partially deadened. Okay, that happens less than 5% of the time. Might have temporary numbness of the skin over the procedure site, a very rare spinal cord trauma. The average pain relief in one study was 472 days, which is over 15 months. And studies have shown that if the pain comes back, you can repeat the procedure with the expectation of the same result. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state participating in the network, accepting over 50 insurances, providing over 25 treatment options with the board-certified, award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.